Welcome back to NerdMDs StackBytes, where we turn one of our latest Substack posts into a 10-minute power session. This allows our subscribers to listen to a discussion about recent content to further digest our NerdMDs content. We are here for you readers and listeners. The link to the Substack article will be in the show notes. Sit back and relax and enjoy this most recent NerdMDs StackByte.
Have you ever been in that situation where you're just waiting, waiting for that perfect tool, that bit of tech that's going to change everything, make your work smooth, finally free you up?
Oh, definitely.
And then it either never quite shows up or maybe it arrives, but it's just not really it, not what you actually needed.
Right, the promise versus the reality.
Exactly. So what happens when you decide, okay, I'm done waiting for someone else to fix this? What if you just build it yourself?
That's a big step.
It is. And that's the core story driving our deep dive today. We're jumping into the world of AI in healthcare, specifically looking at something called ambient AI. And we're going to unpack this really interesting journey of a healthcare tech leader, someone who was initially a huge champion for vendor-provided ambient AI, really believed in it.
Okay.
But then in this fascinating pivot, walked away from it to build something totally different, something much more integrated.
So ambient AI, just to set the stage, the basic idea usually is to kind of revolutionize how doctors document things.
Right.
Imagine a system listening into a patient visit and automatically writing up the clinical notes. The idea is to free the doctor up, let them focus on the person, not the keyboard.
Which sounds amazing.
It does. It targets that huge administrative burden. So our mission today is to figure out why, even when these tools were working, getting good feedback, this expert decided, nope, not enough.
Yeah, what does that tell us, especially about where AI needs to go in these really critical areas like medicine?
Exactly. What's the deeper lesson here?
So our source material comes from someone described as a chief medical informatics officer turned chief workflow hacker. Love that title.
Ah, yeah, good.
And his thoughts are in this piece called, pretty bluntly, Why I Don't Need Ambient AI Anymore. So we'll get into his early excitement, the paradox of why it wasn't quite right, the problems he saw with current tools.
The vendor side of things?
Yeah, and then what they actually built instead, and ultimately what this whole experience teaches us about AI's real future.
Sounds great. Let's dive in.
Okay, so let's start where he did, with real, genuine enthusiasm. Because the initial promise of ambient AI, super compelling. You can easily see why people, including our source, became like true evangelists for it. He talks about using tools like Abridge himself a lot, testing out Nabla. He even joined a company, Heidi Health, specifically because he was so convinced these tools could fundamentally change how doctors work.
And you can absolutely see why. The core problem they were tackling for doctors was just massive.
The paperwork burden.
Exactly. Think about all the hours clinicians spend after seeing patients, just typing up notes, time away from other patients or learning or, sleeping.
Right.
So the promise was automate a big chunk of that. And the early results, they were real. He mentions providers feeling real relief, like they could actually be present with their patients again.
And patients noticed too.
Apparently so. Smoother visits, he says, because the doctor wasn't constantly glued to a screen. The connection felt more human. So the utility seemed obvious. The impact was definitely there.
Okay, so it's working. People feel relief. Patients like it. But despite all that, our source hits this wall, this critical disconnect.
Right.
The tools were useful, sure, but they weren't quite meshing with the actual way medicine works, the messy reality.
Yes, the real world.
And this is where it gets really interesting. What was it? What made him say, okay, this isn't the long-term answer, even though it seemed pretty successful on the surface?
Well, this gets right to the core problem he identified. Most ambient AI tools, the way they're built now, they follow a pretty generic kind of linear workflow.
Okay, like what?
Think of it like steps. Step 1, record the conversation audio. Step 2, transcribe it. Step 3, the AI spits out a standard SOAP note, subjective, objective assessment plan.
The basic clinical note format.
Right. And step 4, you take that note and drop it into the patient's electronic health record, the EHR. Seems logical, right? Neat and tidy.
Yeah, sounds straightforward, but...
But, as he forcefully puts it, that's not medicine, the actual practice. It's way messier than that neat little pipeline.
How so? Give us some examples.
Well, think about async messaging. Doctors are constantly dealing with messages back and forth with patients, specialists, nurses outside of scheduled visits. Patient sends an update via the portal. Nurse asks a question later. It's not live. It's asynchronous.
Okay, yeah, that happens all the time.
And you've got multiple team members dipping into the chart. The pharmacist checks meds, the physical therapist looks at progress notes, maybe a care coordinator checks in. It's collaborative, not just one doctor, one note.
Right. Different people needing different info at different times.
Exactly. And then there's the longitudinal context that spans years, especially for chronic conditions. A patient isn't just today's visit. Their story involves years of labs, meds, life events. How does a simple visit-based AI make sense of all that ongoing narrative?
Good point. It can't just look at one conversation.
And critically, real medicine involves blending structured data, like precise lab numbers, vital signs, with all the free text notes and those patient messages. It's a mix. And none of that complexity, that back and forth, that history fits neatly into a linear pipeline.
So it's trying to fit a square peg into a round hole, basically.
Kinda, yeah. The model is too simple for the reality.
So when clinicians point out these complexities, what's the usual response from the vendors?
Our source mentioned something about templates.
Right. The common answer is, oh, we have templates. You can customize the output, which, sounds helpful at first glance.
But you're saying it doesn't really fix the core issue?
According to him, no. Templates treat the workflow like you're just filling out a form differently. But the real issue is that healthcare workflows are deeply embedded. They're incredibly specialty specific. Cardiology is totally different from mental health, and crucially, they're often nonlinear.
It's not just about the final no format. Exactly. It's about how the whole team delivers care. And what's really interesting, he points out, is that as we move more towards these tech-enabled hybrid ambulatory models, virtual visits, remote monitoring, more portal use.
Yeah, that's definitely happening.
It just makes things more complex. You get more edge cases, more unique situations, and even more need for team-based interactions.
Yeah.
These standard linear vendor tools just aren't built for that native complexity. They're kind of patching over the problem, not solving it from the ground up.
Okay, that makes sense. So the tools were helping with one specific pain point, the note-taking, but missing the bigger picture of the actual workflow.
That seems to be the crux of it.
Which brings up a deeper question then. Are these vendors actually solving the right problem? Or maybe they're solving it for the wrong customer, or in the wrong way?
That's a really sharp question, and the source digs into this. The typical vendor playbook, he says, is something like this. Take a powerful AI model from, say, OpenAI or Anthropic.
One of the big foundation models.
Right. Then you wrap it in a workflow, basically build an application around it. Then you try to bolt it onto an EMR, the electronic medical record system, and then you sell that package to large health systems.
Okay. Sounds like a standard tech strategy.
It does, but there are problems. Large health systems, historically, move slowly. Their existing infrastructure is brittle. Think legacy systems, complex integrations that are hard to change. They're often wary of adopting lots of separate bolted-on tools.
So the sales cycle is long, integration is tough.
And maybe the tool itself is built for this idealized generic workflow, not the messy reality inside that specific hospital or clinic system. And this whole situation now really sets up a classic innovator's dilemma for a lot of these ambient AI companies.
How so?
Well, the source points out a pretty big vulnerability. He says, when your entire business model is just a wrapper on someone else's foundation model, and you don't own deep integration, you're always one platform shift away from irrelevance.
Meaning if the big guys build something similar.
It's exactly. If the platform you're bolting onto or the company providing the core AI decides to offer similar features natively, your wrapper business certainly looks a lot less essential.
Ah, okay.
Customers, like those big health systems, often prefer getting features directly from their main EHR vendor like Epic, the big one, even if it's just semi-native. Why? Because it's usually simpler, more integrated, better for security, compliance, data flow. It just fits better into their existing world.
So the example he gives is if Epic announced its own ambient AI solution.
Right. He wrote this around the time of Epic's big user conference, UGM. And he basically said, if Epic announces even a semi-native ambient solution, a lot of these standalone startups could be in real trouble. It raises this big question about how defensible their business is long-term if they don't truly own the core workflow integration. They're useful, yes, but maybe fragile.
That's a really sobering point about the business model side, and it perfectly sets up the turning point in his story. The moment where he and his team just realized, look, waiting for the perfect vendor tool, it's a waste of time.
Yeah, the market wasn't delivering what they truly needed.
The tool that actually fit how they practice medicine just wasn't out there. So they made this huge call, stop waiting and start building.
A major shift.
Totally. So what did they build? How was it fundamentally different from the ambient AI tools they'd been using?
Right. And the goal wasn't, as he says, to outcompete the incumbents or build the better Abridge or the faster Nabla. It wasn't about beating the vendors at their own game.
It was about
creating something that actually fit us, fit their clinicians, their workflows, the messy team-based reality we talked about. So the system they designed wasn't centered around that simple linear dictation model at all.
Okay, so what did it do?
It had features built around their actual needs, things like real-time loops between async communication and life care. Imagine smoothly transitioning context from a patient's portal message right into a telehealth visit, with the AI understanding the connection.
Wow, okay. That sounds powerful.
And context-aware summarization across messages, labs, and notes. This means the AI could pull relevant info from anywhere in the patient's record, or a lab result from last month, a specialist note from last year, that async message from yesterday, and synthesize it intelligently.
So not just summarizing the single conversation.
No, pulling it all together. Then there was a synthesis layer that merges pre-visit intake. The forms patients fill out beforehand with conversational notes, and crucially, ties that directly to actionable clinical decision support.
Meaning it helps the doctor think.
Exactly. It's not just taking dictation. It's actively surfacing relevant guidelines or potential issues based on the conversation and the patient's full history right in the moment.
That's a big leap.
Huge. And finally, he emphasizes that the outputs were designed for team workflows, not just solo documentation. The system could generate notes or tasks specifically tailored for a nurse or a care coordinator or another specialist involved in the patient's care. It reflects how healthcare is actually delivered by a team.
That makes so much sense. It's building for the reality, not the idealized single doctor scenario.
Precisely.
And that's why he makes this distinction, right? He says, this isn't ambient AI in the old sense. It's something more profound, which he calls ambient cognition.
Yes, I love that term.
It really captures it. AI that's wired directly into the way we deliver care, not just kind of hovering around the edges trying to produce a SOP note.
It's about the AI becoming part of the clinical thought process itself, enhancing judgment, not just documenting after the fact. A shift from AI helping document to AI enhancing thinking.
Which leads us beautifully to the deepest lesson here, the core insight from his experience. The best AI doesn't look like AI.
It's so counterintuitive, but so true when you think about it.
What does that really mean in practice?
It means the most effective AI isn't the one that's flashy, the one screaming, "Look at me, I'm ambient," or constantly reminding you it's there. Instead, the best AI just shows up as better performance. It looks like speed, your workflow is faster. It looks like clarity, complex information becomes easier to grasp. It looks like confidence in your clinical flow because you trust the system is helping you catch things.
So it's invisible, but the effects are obvious.
Exactly. For the user, for the patient, it should feel invisible, but magical. Like a great operating system on your computer. You don't notice the code, you just experience things working smoothly, intuitively.
That's a great analogy.
And connecting this to the bigger picture, it's about aiming for ambient systems thinking. Designing tools that get so deeply embedded into how we work or learn or live that they stop feeling like tools and start feeling like an extension of our own judgment. They just disappear into the background and make us better.
That's a really powerful concept, way beyond just healthcare documentation.
Absolutely. It applies everywhere.
And thinking this way, it completely reframes the fundamental question we should be asking. Our source puts it perfectly. He says the question becomes not which vendor should I pick, but how can I make my workflow natively intelligent?
That's the paradigm shift. It's about ownership and integration, not just shopping for features.
So just to wrap up this incredible journey we followed, it began with real excitement for ambient AI, recognizing its power to ease the documentation nightmare.
A very real benefit.
But then came the collision with the messy, non-linear world of actual medical practice. The realization that the off-the-shelf tools, however helpful, just didn't quite fit.
The workflow mismatch.
Which led to that pivotal, powerful decision, stop waiting, start building. Creating a solution that wasn't just bolted on, but natively integrated, designed to enhance clinical cognition, not just capture words.
And the core aha moment from all this is truly profound, that the most impactful AI, especially in complex fields, often becomes invisible. It blends seamlessly into how we work, enhancing our abilities, making us faster, sharper, more confident, rather than just being another separate tool we have to manage.
It ultimately improves things for everyone involved, the clinicians, and most importantly, the patients.
That's the goal, right?
So that leaves us, and you listening, with a really interesting question to mull over. In your own work, or even just your daily life, where are you maybe still shopping for that perfect external solution, that magic bullet app or service? And where instead could you adopt this workflow hacking mindset? How might you start thinking about building or integrating intelligence natively into your existing processes, making the tech disappear in a way so it just becomes a seamless, powerful extension of what you already do?
It's a different way of thinking about technology and improvement.
Yeah.
Definitely something to consider.
Thank you for listening to Efficiency Unlocked, Nerd Tested, MD Approved, a NerdMDs podcast by Drs. Adam Carewe and Dale Gold.